Hi everyone, I'm Stephanie with 9Health. Today we want to talk with you about our fall 9Health Fair season. The first one is this Saturday at Arvada Covenant in Arvada from 7 to 2, right Alex?
That is correct. Yes.
It's a longer one, so that's kind of good. You have a lot of the day to get there. So we just wanted to talk about changes because obviously we're still in the COVID-19 pandemic. We had to cancel our spring 9Health fairs due to that. And now we're going to kind of run a handful of fairs and put some safety measures in place so you can get out there and get those screenings in person that you've been wanting to get. We had a lot of people asking for 9Health fairs, so we are trying to provide that service for them. So I'm joined via Zoom by Alex Andrews. He's our 9Health Director of Volunteer Engagement, and also Dr. Pyle Coley, our 9Health expert. She's a cardiologist, but also an expert on internal medicine and preventive medicine. So you can ask her any questions that you have about anything really too health related. But first, Alex, we mentioned that COVID-19 forced us to cancel those spring 9Health fairs, but now we've added some safety measures in place. We're able to have some fall 9Health fairs. How will the fairs work during the pandemic and what can people expect?
Yes, so very good question. We want to make sure people are safe and comfortable. So we went through county health regulation and approval for each separate county where these fairs are running, and made sure that our different protocols and safety measures align with those different county measures and requests. And we passed, of course. So we are running 8 fairs. And when you come, our preference is that you register online. We really want to make sure to space people out safely. As everybody knows, we're trying to social distance in everything that we're doing in our lives right now and give people space so we slow the spread. So we will have those online registrations available for you. And I'm sure, Stephanie, we can post where they can register. So that's the preference. We do have some walk-in registration available. We know not everybody has a computer or access to register online, but we really want to limit that. So if you do come, it's really first come, first serve. If the fair is already too crowded and we're at our max capacity, then we may ask you to register for a different fair or a Quest Patient Service Center. Masks are required. We are giving each of the phlebotomists a 15-minute window to get your blood drawn. That's really the primary focus for these fairs, is blood draw. So we want to give people an opportunity to get their blood screenings. A few of our fairs have ask a medical question. So you can sit down with a nurse or a doctor. And then all of our fairs are going to have flu vouchers, and 6 of them have flu shots for a portion of the fair. So we definitely want to keep people safe and hopefully take care of your blood screenings that you guys did not get back in the spring.
Yeah, and Alex just mentioned it again. We'll offer those lab screenings, the blood screenings. So you won't see a lot of, if you come to 9Health Fair before you walk in, there's a lot of tables, a lot of community stuff happening. That stuff won't be there, but you can still come in and get those affordable blood screenings. And like she said, some will still have the Ask a Doc station, so that'll be nice. And free flu shots or flu vouchers. Arvada Covenant this weekend is one that will have free flu shots. So go in, get your blood work done, get free flu shots. Someone did comment, so if everyone goes, are you going to tell us if we have COVID? We're not offering COVID testing. We will have the antibody test, the blood test. You can get that as part of your blood panel. You can do your blood chemistry, check all those levels of information, and also get an antibody test, but we're not doing the nasal swab COVID test at these health fairs. So I want to clarify that. Dr. Coley, it's important for people to receive preventive screenings right now. At the beginning of the pandemic, obviously we're saying stay home, don't go anywhere, not even your doctor for anything. But now it's important really to get back into that habit of getting those preventive screenings done. So give your pitch for preventive health.
So, I say that prevention is going to be the biggest casualty of this pandemic, because we have gotten very good at wearing masks, at socially distancing, at washing our hands, at doing the things we need to do to keep this virus at bay, to flatten the curve of the viral infections. We know how to do that. But a big casualty of the pandemic has been people avoiding medical care, people not getting their prescriptions filled on time, and especially not doing the types of screenings that pick up problems before they develop. And unfortunately, as you mentioned, we had to cancel our spring health fairs this year because of the pandemic and because of the peak of the viral activity. But this is a great opportunity to really flatten that curve as well and make sure that prevention doesn't become the next casualty of this pandemic, because that's going to play itself out not today, not tomorrow, but 5 to 10 years later, when we develop diabetes that we could have avoided, or we have a cancer that we could have detected early. So it's really now encouraged to start thinking about prevention again, because we're not just living in this mode for a little period of time. We're living alongside this virus now for the next at least a year, in my estimate, if not longer, until there's wide vaccination available. So in the meantime, we have to start focusing on our preventive health. And this is a really good opportunity to start on that journey to really get a snapshot of our health and then figure out what it is we can do to improve it.
Yeah, and due to the pandemic, we've offered a few different ways to get these preventive screenings done. We have preventive screenings you can get at Quest Patient Service Centers. You can go to 9healthfair.org and sign up for those as well. So if you're not ready to go to a fair, the fairs aren't near you, or that doesn't work for you, that is an option as well. Along with 9Health at home, there's a few screenings offered that you can do in the comfort of your own home. Do a drop of blood, put it on a card, mail it in. Along with our colon cancer screening kit, you can do at home. So there's a couple other options as well to get that prevention done. But people really did want to have the 9Health fairs. They're used to us offering that service, and they really wanted that. So we were hoping, that you guys come out and get your screenings done, and we were able to provide that this year. So Alex, we talked a little bit about it, but let's talk a little bit more about what screenings will be offered at the fairs, because it is different.
Yeah. So, as everybody knows, that blood screening is what the average 9Health Fair participant is looking for. So we'll have our blood chemistry test and vitamin D test, vitamin B12. There are a whole menu of different blood screenings that people can do. And if you do want to sit at that Ask a Medical Question station at a few of the fairs, you can ask really any medical question there, and they have a whole list of different resources. So some of it is education based, some of it is geographic based. So if you're looking for a provider to follow up with, those medical providers will have the resources on hand with them. And then the pharmacist giving the flu shots will be able to either take the vouchers that we can provide, and that luckily was a donation in partnership with Safeway Albertsons. So you can use that voucher if you don't have insurance, or the pharmacist will bill your insurance right on the spot. So those are really the three main things that people will be able to get done at the fair this fall.
And Dr. Lewis, just talking about all those screenings that are available, what do you suggest that people get done? I think our blood chemistry, I was just trying to look it up, is like 28 levels of information. You get kidney health, you get your thyroid function, TSH, you get cholesterol, that kind of stuff. But what screenings do you suggest people get?
So it's a little bit a function of your age, your medical problems, and what medications you're taking, which would be the right sort of screening panel for you. But for most average adults, at least once a year, we want to check their cholesterol. So lipid panel is a good test to get at least once a year. We also want to screen most average Americans for diabetes, at least usually once a year or once every 2 years, depending on your family history and genetic predisposition. But age is the strongest predictor of diabetes. And so as we get older, that risk goes up. So those two I would absolutely recommend for almost everyone that's coming into the health fair. People often ask the question if they need to be fasting for their lipid panels, and the new guidelines actually recommend that a fast is not required. Now, for some of my patients, I still recommend that they fast because it does give us a slightly more accurate estimation of some of the lipid parameters, such as their triglycerides. But, if you're diabetic, you take insulin, you think you might not be able to fast or anything like that, then don't stress about it too much, because remember, this is just a screening test. And if something comes back abnormal, we could always repeat the test with a fast. Now, some of the other tests you've talked about, electrolytes, kidney functions, those tests are important in certain types of individuals. So the type of individuals that may be predisposed to kidney disease and not realize it, because early stages of kidney disease are asymptomatic. And those would be people who have hypertension or high blood pressure, those who have diabetes, those who are obese, those who are taking certain types of medications like ibuprofen that can increase your risk of kidney disease. And then if you're on a diuretic or water pill, then it might be a good idea to check your electrolytes, which is included in that chemistry, because your electrolytes can get depleted very quickly, especially here in Colorado where it's so dry. And then there's also vitamin levels. So vitamin D deficiency has been implicated in a number of different conditions. It's been associated with an increased risk of heart disease. It's been associated with impaired immune function. So that may be a good thing to check as well, particularly if you feel like, you may not follow a well-balanced diet. If you're vegan and you don't drink a lot of milk or eat a lot of yogurt, that might be a good test to get as well. And then we also offer HSCRP, which is an inflammation test. Now that I also recommend for most people to help help determine what their cardiac health is, because it really helps to risk stratify. So, it's a lot of tests and it can be overwhelming, but the way to really decide, you want to get the usuals, the lipid and the hemoglobin A1C, and then if you want to talk to a medical volunteer or call the 9Health Neighbors line, they might be able to help you based on your personal risk profile, really personalize what types of testing and screening you're getting.
Yeah, I was just going to mention that as well. The 9Health Neighbors line is still running. We have medical volunteers that will call you back. It's 303-698-4455, extension 2005. I can put that in the comments. I did just put a link in the comments to all the available screenings. There's also a link in the comments to go register for a fair. You can see a full list of the 8 fairs that we are offering around the metro area, but some also kind of further out. So trying to really, some of the fair sites and volunteers really stepped up to be able to offer the fairs with all the safety precautions. So we're thankful to them for doing that. Alex, do you still need volunteers for the fairs? Speaking of volunteers.
Yeah, there are a few fairs. So on October 3rd, we have 2 fairs, another one in Arvada, it's Lamar Street Center, and then one in Heritage Todd Creek is the name. It's out in kind of northeast Thornton area, really close to Brighton. They could use a few more phlebotomists and non-medical volunteers. They're pretty close to what they need, but a few more would be fantastic and help them meet their needs so everything runs really smoothly. And then after that, we have some mountain area fairs in Bailey and Alma. Alma is really close to Fairplay. They both need phlebotomists and non-medical volunteers still. So those 2 are probably our highest need fairs, the one that I mentioned in Bailey and Alma. So it would be great. Even if you live in Lakewood, it's pretty straight shot up to like Conifer Bailey area, not too far out. Alma is a little bit more of a trek. It's about a 2-hour drive from the metro area. So that's a time commitment for our metro folks. But if there's anybody listening that's near Buena Vista, Fairplay, Summit County, those places are actually relatively quick to get to Alma. So it'd be great if we could get some more volunteers from those communities.
And if someone wants to volunteer, how do they do that?
Yeah, so you can link to our volunteer registration system from the main 9Health Fair website, but if you want to go directly there, it's 9healthvolunteer.org, and that's where you sign up, that's where you register. If you already have an account, you're going to click login, and if you don't know your password, there's a forgot your password link on that login page. If you've never signed up to be a volunteer with us before and you want to start out this fall, then you're going to click the sign up button, and it'll take you through how to set up your profile.
Great. And I know when we canceled those spring 9Health fairs, you know, so many volunteers really wanted to help out. That's why we came up with the 9Health Neighbors idea. So yeah, I know there's a lot of people out there that probably still want to help out, and yeah, all of this. Dr. Cole, I wanted to ask you too, just when we were talking about screenings, the COVID-19 antibody test is one of the things we are offering. Who should get that? And if someone thinks they had COVID like 4 months ago, would it even show up now? Would an antibody show up now?
Yeah, so that's a great question. So we're learning a lot about antibody responses to COVID-19, and you know, as we've talked about, there's a few different COVID tests. One is the nasal swab or the PCR test, which looks at whether you have infection right now. There's also a new antigen test that takes about 15 minutes and costs $5 that also looks at whether you have infection right now. The only test that we have to tell us whether you had infection before and recovered is the antibody test. So that looks in the past and really tells you whether or not you've had infection recovered. Now, you asked the question about when is the right time period to get it, and the science is really mixed on this because we're getting some data that starts to tell us that the antibodies can start to attenuate or go down as early as 30 to 60 days after infection. So let's say you had infection in June, 1 to 2 months later, right now, your antibodies may already start to go down. But you don't want to check it too early because it takes at least 2 weeks for those antibodies to start to go up. So what I say is really the right window or the sweet spot to really check the antibody test is about 2 weeks after you think you might have had the infection, up to about, we're thinking several months, 3 or 4 months. We're not entirely sure where that kind of back end of it is. But everyone shouldn't get the antibody test. It's really only people who think they may have had the infection and recovered and it was undiagnosed, is people who may want to donate their plasma because that's being studied as an experimental treatment to help others. And if you're a healthcare worker, frontline worker, somebody who has a pretty high risk of exposure, even if you didn't have symptoms, because we know that this virus can be asymptomatic in a good percentage of people, it might be reasonable for you to get an antibody test as well.
And it's not something you get if you have COVID-19 symptoms currently. We don't want people coming to the fairs that have COVID-19 symptoms thinking they need an antibody test.
Right. Exactly right. And as I said, it takes 2 weeks to even go up after your infection resolves. So that's not the right test to come to the fair to get. If you think you might have COVID, you want to go to Pepsi Center or one of those other active COVID testing sites where they do the nasal swab. But this is really to look back and say, hey, was that illness that I had a month or two ago, do you think that that may have been COVID?
Right. And then I wanted to ask you too, just touching on the flu shots and flu vouchers that Safeway and Albertsons are providing. Why is it extra important with the pandemic to get your flu shot this year?
Yeah, we're calling this the twindemic because it's really the confluence of two different infectious disease outbreaks occurring at the same time. Earlier this year, the flu activity was going down when we were heading head on into the COVID season. And now it's the opposite. Not only is COVID really high, in fact, here in Colorado in the last week, we've had greater than 50% increase in our new cases. So it is really, really, really angry right now, that virus. But flu season is about to start and pick up as well. So there's several reasons why you want to get a flu shot this year more than ever. The first is because the overlap between symptoms between flu and COVID is so much that if you have flu-like symptoms this year, you're going to miss work. Most likely people are going to think you have COVID. If you end up in the hospital, you'll even be on a COVID ward, and it's really going to cause a lot of functional impairment to your life. And you may even get therapies for COVID until that test comes back establishing that you have the flu. The second reason is because we want to keep people out of the hospital. So you're doing it for the community, because remember, like, we need all of our resources right now to fight COVID, and we don't want flu infections because we have a vaccine that can prevent flu from happening. And then the final reason is that actually getting a vaccine for one infection kind of revs up the immune system, boosts it, so that it gets better at fighting other infections. So even though we don't have a COVID vaccine right now, you really want your immune system to be in the best shape possible at this time as we're heading into this twindemic, where the flu activity is going to go up, COVID activity is going to go up as the weather gets colder, and it's already pretty high. So we could really be seeing a catastrophe on our hands that we can avoid if we increase the rate of vaccinations. Now, in a normal year, about 35 to 40% of American adults get the flu vaccine. And this year, the CDC has repeatedly said we need to get that number above 70%, if not closer to 100%. So we need to double the number of people getting the flu shot that have been getting it in previous years.
Yeah, so hopefully people go out there and get that. Again, get it for free or free voucher at 9Health fairs. There are flu shots available at Arvada Covenant Church this Saturday from 7 to 2. Alex said before we came on, it's recommended you make an appointment for these fairs. Just makes it easier on us during this pandemic so we can monitor numbers. Alex, you said that there's just afternoon appointments now at the Arvada Covenant site?
That's correct. Their morning, anything before noon has filled up. There may be a few 11:45 spots left, but everything else is between noon and 2. So, and I do want to make one quick point too, that when you asked me the question about what it's going to look like, and then we also talked about not wanting people, if they think they are sick, to come to the fairs. Right. And it reminded me, I didn't tell you guys that we will have a health screener outside of every fair. So they're going to be taking your temperature, and it's a touchless thermometer that our volunteers will be using. And then they'll ask you a series of health questions to see if you're feeling okay and it's safe for you to come into the fair that day. So that's another thing to prepare yourselves for.
Yeah, perfect. I was going to ask if there's anything else to add, and I knew we were doing those health screenings. So that's, I mean, it's kind of become our new normal now. You go pretty much anywhere and they're taking your temperature, asking you questions, wear your mask. So all the things you're doing, all the other places you're going, please do those at the 9Health Fair if you're coming, so we can keep everyone safe. Make your appointment, go to 9healthfair.org. I put the link directly to the fair list in the comments. You can grab that there. A couple things before we go. Again, I mentioned if you aren't wanting to go to a fair, there's not one near you, you can get 9Health screenings at a discount at Quest Patient Service Centers. Go to 9healthfair.org and you can find that there on the homepage. We've listed all the different ways to get screenings. You can also do them from home with 9Health at Home. You can get a lipid panel, which Dr. Coley mentioned is one of the recommended screenings, hemoglobin A1C, which is your diabetes risk, along with our colon cancer screening kit. You can do all those from home and send your stuff in and they'll give you results. And if you have a health question, oh, and speaking of results, I should mention this too, with our 9Health fairs this year, you will not get your results in the mail. So you will get them via our online results dashboard. So you'll need to, make an account on 9healthfair.org so you can go in and get your results. You have to do that anyway to make an appointment. So remember your login so you can go back in and look at your results. And if you have a health question, again, mental health question, medical question, anything really that you want answered, you can call 9Health Neighbors at 303-698-4455, extension 2005. You leave a message and within 24 hours or faster, a 9Health medical volunteer gives you a call back. You can talk to a real person and ask your questions, in addition to asking them here on Facebook Live. So I
just wanted to make one comment before we go, Stephanie, if I may. So I just think our health fair this year is really going to be the health fair of the future. So what we've seen for the last many years is, a high highly populated in-person event where there's lots and lots of interaction. And that's really great for community building. But unfortunately, because of this virus and pandemic, we have had to really pivot to a different type of a model. And so I call this the hybrid health fair, where you go in there to get your blood screening, to get your flu shots, maybe ask a medical question, but really we want the conversation to be continuing, and we want the interaction to be year-long, because prevention should really be a year-long priority. So it's not done when you leave the health fair. You know, continue to engage with 9healthfair.org and ask your questions to the 9Health neighbors, and, you know, learn about our educational materials. And a lot of the screenings that we were doing in person are now available online. So it's really become an interactive hybrid experience with in-person as well as the online component. And we really want to encourage people to take advantage of that. So it's not just that you're talking about your health when you're at the fair, but you're continuing to sort of engage with us all year round about your health, when you get your results, what to do with them. And, you know, you really want to think about making prevention a part of your everyday life.
Well said, Dr. Coley. That was perfect.
Yes.
All right, I'm going to let you ladies go. Kim did ask just now, does the website tell us all testing available? Kim, I will respond to your comment when we get off of here and I'll give you the link to all the testing so you have a list of everything that's available at the fair. But thank you, ladies, so much for joining me.
You're welcome.
Thank you.
Bye.